Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, I would like to talk about a novel biologic therapy that targets one of the earliest signals in many allergic and respiratory diseases, Tezspire. Originally approved for severe asthma, Tezspire has now gained a new FDA indication for chronic rhinosinusitis with nasal polyps. Among biologics that treat both asthma and nasal polyps, we already have Xolair, an anti-IgE antibody, Dupixent, an anti-IL-4 receptor alpha blocker, and Nucala, an anti-IL-5 biologic. Tezspire is the newest addition and uniquely the first and only therapy to target TSLP, an epithelial-derived cytokine that sits at the very top of the inflammatory cascade. As allergists and immunologists, we're always excited to see more options in the toolbox because more choices mean more ways to personalize care. In earlier episodes, I discussed Xolair, Dupixent, and Nucala in detail. If you haven't watched those yet, check the links in the video description. But today, our focus is Tezspire. So what should you know about Tezspire? In this episode, I'll walk you 5 key things: its indication, how it works, how it's taken, important warnings and precautions, and its side effects and safety. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Tezspire and who it's for? Tezspire, or Tezepelumab, is an add-on maintenance treatment for severe asthma in adults and adolescents aged 12 years and older, whose asthma remains uncontrolled with their current medications. It was first approved by the FDA in December 2021. It is important to point out that Tezspire's asthma indication is different than other biologics. For instance, Xolair is approved for moderate to severe asthma with evidence of allergy to environmental allergens. Dupixent is approved for moderate to severe asthma with an eosinophilic phenotype or for oral steroid-dependent asthma. Nucala, on the other hand, is approved for severe asthma with an eosinophilic phenotype. Tezspire, however, is simply approved for severe asthma without requiring allergy testing, eosinophil elevation, or steroid dependence. This broader indication reflects Tezspire's distinct mechanism, which allows it to work across a wide range of severe asthma types. In October 2025, Tezspire received its second FDA approval, this time for chronic rhinosinusitis with nasal polyps, as an add-on maintenance treatment in the same age group. In clinical studies, Tezspire reduced nasal polyp size, improved congestion and smell, and decreased the need for sinus surgery or systemic steroids. And just to be clear, Tezspire is an add-on therapy. It does not replace quick relief inhalers or emergency treatments for acute asthma symptoms or attacks. Second, how does Tezspire work? To understand how Tezspire works, we need to start at the surface of the airways and sinuses. When your respiratory tract encounters triggers such as viruses, allergens, smoke or pollution, bacteria, or even physical irritation, the epithelial lining cells produce and release alarm signals, known as alarmins. 3 important alarmins are interleukin 25, interleukin 33, and thymic stromal lymphopoietin, or TSLP. TSLP acts as an early upstream switch that activates and sustains a wide network of immune cell activity. Once released, TSLP promotes downstream inflammatory pathways that contribute to asthma symptoms, such as wheeze, cough, and short of breath, as well as the chronic inflammation that drives nasal polyps. Tezspire is a monoclonal antibody designed to block TSLP and prevent it from binding to its receptor. By intercepting this early alarm signal, Tezspire quiets the entire inflammatory cascade responsible for airway narrowing, mucus production, and hyperresponsiveness in asthma, as well as persistent inflammation in nasal polyps. Because TSLP sits high in the pathway, Tezspire may work across a broad spectrum of patients, including those with allergic or non-allergic disease features, and across diverse inflammatory profiles. Third, let's talk about how to take Tezspire. Tezspire is given as a 210 mg subcutaneous injection once every 4 weeks. There is no loading dose, no weight-based dosing, and no adjustment in frequency. It is available in a single dose vial, a prefilled syringe, and a prefilled pen. The vial and prefilled syringe are typically administered by a healthcare provider in the clinic. The prefilled pen can be used at home by patients or caregivers after proper training and after a healthcare professional determines that home administration is appropriate. Detailed instructions for the pen are available in the instruction for use section of the package insert and on Tezspire.com. If a dose is missed, it should be taken as soon as possible, then return to the usual schedule. If the next scheduled dose is already due, simply administer that dose as planned. Do not double up doses. Fourth, let's review the key warnings and precautions for Tezspire. First, hypersensitivity reactions, including rare cases of anaphylaxis, have been reported. Serious allergic reactions may occur within hours or even days after injection. If any symptoms of an allergic reaction occur, including rash, breathing problems, hives, red, itchy, swollen, or inflamed eyes, lightheadedness, dizziness, fainting, or swelling of the face, mouth, or tongue, patients should call their healthcare provider or seek emergency medical care right away. Second, patients should not stop inhaled or systemic steroids suddenly when starting Tezspire. Any steroid taper must be gradual and supervised by a physician to avoid withdrawal symptoms or worsening of underlying disease that were previously controlled by corticosteroids. Third, because TSLP may play a role in the body's defense against certain parasitic infections, it is unknown whether blocking TSLP will change how the immune system handles these infections. Patients should be treated for any existing parasitic infection before starting Tezspire. If a new parasitic infection develops and does not respond to standard anti-parasitic treatment, Tezspire should be paused until the infection resolves. Lastly, Tezspire has not been studied with live-attenuated vaccines, so these vaccines should be avoided during treatment. Patients should inform their healthcare provider that they are receiving Tezspire before getting any vaccinations. And finally, let's talk about the side effects and safety of Tezspire. Overall, Tezspire has demonstrated a favorable and well-tolerated safety profile. In asthma studies, the most common side effects, sore throat, joint pain, and back pain, occurred at rates similar to placebo. In the nasal polyp study, cold-like symptoms, upper respiratory infections, nosebleeds, sore throat, back pain, injection site reactions, and joint pain were most common, again with rates generally comparable to placebo group. There is, however, one safety signal noted in the long-term extension study for severe asthma. In that study, serious cardiac events were rare in both groups, but occurred somewhat more often in patients receiving Tezspire. About 1 out of every 100 patients per year experienced a serious cardiac event on Tezspire, compared with 1 out of every 500 patients per year on placebo. For major adverse cardiovascular events, meaning heart attack, stroke, or cardiovascular death, the numbers were closer together. About 1 out of every 160 patients per year on Tezspire versus 1 out of every 240 patients per year on placebo. These events were uncommon, and the risk difference was small. The clinical significance remains uncertain, but it is something clinicians and patients may consider when evaluating treatment options, especially for patients with existing cardiovascular risk factors. And there you have it, 5 key facts about Tezspire, the first-in-class TSLP targeting therapy for both severe asthma and nasal polyps. It acts upstream in the inflammatory pathway, offers convenient once-monthly dosing, and brings strong clinical data supporting its efficacy and safety. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.